Hello everyone. I hope you can all see me. Okay, I have a wave already. That's nice. Thank you so much of all of you to join in. I hope आप मेरी आवाज़ सुन सकते हैं. Give me a thumbs up if you can. And thank you so much for sending all the love. We are here for something very, very exciting. Hello, hi. Hello everyone. Hi Shilpa. Hi Sarika, how are you all doing? Oh, perfect. It's great. I love these chats. It's so good to, talk to you all. And we have something super exciting today for all of you. For myself as well, I'm really waiting. मैं बहुत wait कर रही हूँ इस session का, and definitely we have something great in store for you. And of course, when you will actually see this and when you will hear it, आपको भी लगेगा कि definitely this is something that you needed. And the whole live is around one range, जो I'm sure a lot many of you have already used, and आपको इसकी benefits भी मिले हैं. And इसके ऊपर और बात करने के लिए we have somebody very special who will be joining in. That person of course is a doctor, and she is also not just a doctor but a captain as well. So we will have her joining very soon, and then we will start with this live session. Hello everyone. Hi Tanu. Hello Tanya. Wow, I am loving all the replies and I'm loving all of you that you took out the time and आप लोग सब यहाँ पे आए हमें सुनने के लिए. Thank you so much. So let me check whether we can add Dr. Dipti now. Okay, give me 2 minutes. Yeah, I think very soon we will have her on board with us. Just give me 2 minutes. Okay, we have, yes. It's accepted. Okay, so anytime, I think. Yes,
I am good. How are you?
Hello, how are you? We're great here.
Absolutely.
We're all
I'm
ready
as
to talk to you, to listen to you,
share things with you, and to gain some from our lovely people who've been joining in. And I'm excited to answer all your queries.
Great. So just a little introduction, of course. Dr. Dipti is here with us, and we're very excited to have you on board for this live session on one of our favorite and one of our key ranges in NovAge. And of course, Dr. Dipti is a doctor and of course is a captain as well. And, she has also done a lot of contests. She's also one of the, she contested in the sense for for Miss India, and you were also one of the jury members, so that's great. And I'm sure you have all the expertise that is there to share with us when it comes to skincare. So guys, any skincare that you want to ask to her, anything about NovAge that you want to ask her, please write in your questions. Of course, we will also talk to her, about our range and about all the products that are there. So yes, we have her here.
Yes, please. Let's get started.
And
also, I have not
dig in
participated
then,
in Miss India, but we've juried many Miss Indias and Mrs.
Yes, you juried, of course you have. Yeah, definitely. Great. So, okay, then, we have so many people, who want to know about, different kind of products, how they should use what. And, but always there is one key thing around skincare, that one always wonders that wo kaun se products hain that they should, start their regime with. So, I'm sure as a doctor, you must be hearing this from so many people. So, as per you, what is the way
Okay,
that
so the
one can
old
actually
school
transform
of
their skin
skincare has
by
really
using
changed
such
in the past
products?
few years, and India has really taken over a lot of care. Like especially after COVID, I've seen there's a major shift in how you take care of your skin. So the CTM regime has been turned over, and now
Yeah.
it's become more like you cleanse your face. You have to apply an antioxidant serum. For that matter, the commonest is the vitamin C that everybody has been using. So post your
Yeah.
cleansing, you can use the antioxidant serum to protect the skin barrier, to help your production of collagen and elastin. And after the serum, you can
Mm-hmm.
hydrate your skin with a good hydration product. That will depend upon your skin type again. If you have a dry skin, if you have an aging skin, if you have an oily skin. So the moisturization part remains a very particular this thing for a specific skin. After that, very important step is the sunscreen. So these 4 steps are literally mandatory
Absolutely.
for everyone in the morning. At night, definitely, I would recommend that you should be using
Mm-hmm.
something more active, as in the active ingredients which will help your skin in the improving the condition that you're looking
Mm-hmm.
for. Like for example, have pigmentation, include an anti-pigment care or
Mm-hmm.
anti-pigment cream at night. If you are skin aging, then you have to use an anti-wrinkle or an anti-aging cream at night,
Mm-hmm.
or some, if you have very dry skin, then include peptides in your regime, or
Right.
something like hyaluronic acid, or like deep hydrating agents at night. Again, it depends on your sensitivity of the skin, how your skin
Right.
reacts and what is your
Okay.
lifestyle. A lot of things depend on that. But I would say the night care majorly
Mm-hmm.
remains to
Of
treating the
course.
skin, and morning majorly remains to protecting the skin.
Mm-hmm. Actually, that's something very interesting that, how you can switch a day regime to a night regime. So it's very important that hydration is the key and when is moisturizing the key, because a lot of people say, a cream hai, so let's just use it day baby and night baby. But it's very important to actually differentiate, so that we have two different types of cream for the day and the night. So that's a very great point. Yeah. And, while you were saying about actives, now I know in our language, people who know about skincare, of course, we all know ki, actives do great for our skin. But if we talk about to a layman, like what are these actives and how do they
The
actually help,
actives are
in your skin? So
chemicals or
how would
the
you explain that?
ingredients inside your creams or serums which actually work on the skin, which can penetrate in the skin and give you results without giving you any side effects. Like they have to be balanced. So the actives are essentially the main ingredients of your creams and serums which are actually
Mhm.
acting on your skin and which can give you benefits.
Okay, wow. So you mean अगर हम ये actives किसी product में भी, if we can
Absolutely.
have
So
them, so
that's
they
the
will
main
just help
treating part of the
make
product.
that product even better. Okay, great. And when we talk about these actives, many people say that, should I be using them? ये मेरी sensitive skin को क्या cater करेगा? Or, will it be too much for my skin? Maybe मैं breakout करने लगूंगी or लगूंगा, so many questions are there around the usage of these actives. So what do you have? I mean, you obviously, have some, obviously you have a lot of knowledge around this. So what do you
So
say
if
to
you do
your,
have doubts
people
about the
coming into
actives,
you
like
or
first
just
of all,
talking it
actives are
around that?
usually prescribed by dermatologists. So that your skin, we assess your skin before prescribing anything. We need to know a lot
Mm-hmm.
before we prescribe you anything. And these are according to the skin type, according to the condition, according to what is your issue in the skin. And if you do want to pick up from over the counter, then just make sure correct actives for your skin type. Although the over-the-counter products are usually less potent, so they do very less harm in case somebody is very, very sensitive. Other than that, they're usually quite tolerable. If it's from a good brand, they are usually mildly potent, very mildly potent. So they're more
Okay.
like maintenance kind of thing rather than actively treating a certain thing. So I would say
Okay.
they're relatively safe when it comes to the over-the-counter
Mm-hmm.
products, as compared to the products which are in the pharmaceuticals, which are very, very important for you to go to your dermatologist and discuss and then start that regime. So like AHAs and BHAs that we commonly talk about. These are
Yes.
the alpha hydroxy acids and the beta hydroxy acids. So for example, one of your products has AHA peel. It's like, it's called 6. Since you send me the
Right.
products, I would like to show people that this is
Exactly.
from your range and 6% AHA peel.
Yes.
So when we talk about
That's
AHA,
great.
it is alpha hydroxy acid. Now these acids are helping in exfoliating the skin. Now these exfoliation of the skin should happen regularly. Now our skin cells are shedding at a regular interval, but over a time the skin cycle gets disturbed, and to get the skin cycle the routine, these AHAs play a major role. So now what happens with exfoliation? It is also stimulating your skin cells to produce more collagen.
Yeah.
So you're getting rid of skin, the dead skin that is not needed. You're making the cell turnover faster.
Yeah.
You're making your skin boost more collagen. So it is helping your skin. So when we talk about peel, so when a product is called just AHA, it has some AHA. It is a very mild form of AHA. But if something only like 6% peel, like your product, this is little more potent than a simple AHA. So you have to apply not regularly, not like every night. You can include it like every alternate night in the regime. It can be used for aging, it can be used for hyperpigmentation. So AHA is like a wide range of things that it can treat. And being a very mild thing inside over-the-counter product, it can be helpful to use it like just alternate nights, include it in your regime, and it should help you with many things. Yeah.
So that's great. I think also with AHAs, sometimes we also say for people who have little sensitive skin कि आप शायद उसको हफ्ते में एक बार use करें, but it's good कि if your skin is able to adapt, तो आप इसको every alternative, days भी, nights भी use कर सकते हैं. We just have like comments that people want to hear Hindi, so maybe we can do a mix of, Hindi and English both. Yeah, I think we can try that definitely. So great. I think aapne, you've talked about AHA, and of course the AHA that we have is a mix of both glycolic and lactic. So, it's kind of like, soothing element, plus it also kind of works on your exfoliation. So I think that mix is quite nice. And yeah, and not just that, exactly. And not just that, of course, we have, these AHA properties, of course, exfoliate karte hain. But also we have something which brightens and which helps to kind of illuminate the skin. It helps to even out the skin. And for that, we have vitamin C. Now, I'm sure a lot of people already vitamin C use karte hain, but in some form or the other, it's like, you want to amp up your fruit intake because usme vitamin C hai, because we all know vitamin C is great for the face and for the body as well. But what is that special thing about vitamin C which you feel, doctor, is
vitamin C has
like
become the most
a
popular
must ingredient
antioxidant
in
in skincare regime as of now. So it's like everybody, even the layman, I would say, knows that you have to use vitamin C on skin. So other than putting on skin, you eat vitamin C, you drink vitamin C, you apply vitamin C. Vitamin C is one ingredient which can be taken in all forms, but the most direct form will be the application on your skin, which is a very, very good form of, taking your vitamin C inside your skin. So yes, I would say that because it is an antioxidant, it is fighting against the free radicals. Now, free radicals kya hote hain? Free radicals are the things which damage our skin or make our body inflamed. Now, these are the toxins which are produced by the body or skin or other organs, during the production of other good things. Some bad things are also produced. Like, these are the free radicals which go and harm certain cells in our body, produce inflammations in the body. So now these free radicals need to be reduced. Now our body has an automatic system to reduce it, but vitamin C and other antioxidants, the category of antioxidant that reduces these free radicals. जब free radicals हैं, आपका anti-aging भी होगा, आपका collagen production अच्छा होगा, skin cells अच्छे होंगे. So all good things will happen if less free radicals are there inside the skin. So it helps with that. It helps with illumination. It helps with radiance. It helps with pigmentation, reducing fine lines, open pores. So multiple benefits of vitamin C. But what is the type of vitamin C, the regularity of vitamin C. It's not that you apply it once a week and then you're done. You have to apply Similarly, vitamin C needs to be there at a certain dose in the skin to give you those results. So it takes time. It's not overnight that you started applying the products, you see the results in a week's time. No, it takes time. About few, like it can take about 4 to 8 weeks time for you to see good.
Okay. Okay. Yes, and I think because it's a potent ingredient, तो उसका effect भी थोड़ा time लगता है, to come. Yeah, and I think what good about NovAge Proceuticals, of course, the vitamin C in it is that it comes in a powder format, and also it has a gel with it. So the kind of packaging that the product has, it's not very volatile. So it's like a good mix of the powder plus the aqueous gel. So what comes to you will be quite potent, and it will not be something जो बहुत ही ज़्यादा overused ho, or something that has been kept for a long time. So I think that is a great way to kind of
For vitamin C,
so
it's very, very
that
important
packaging
about the
also quite
packaging
helps,
because
right?
it's
When
a
we
very
talk about
volatile
vitamin C.
product and it can get damaged very sun light. So yeah, the moment you open the bottle, it can get oxidized and it may not be as potent. So you have to make sure that the packaging is good, that it is not exposed to air.
Okay. I think very important to note कि जो packaging है vitamin C की वो मतलब वो ऐसी बनाई गई है कि वो air से expose नहीं होती, and every time जब आप pump करते हैं so you get real vitamin C का powder जो आपके aqueous gel में फिर वो mix होकर you actually get the right product, and obviously जितना आपका product I would say potent होगा उतना ही आपकी face पे वो reflect करेगा. So in terms of dark spots, in terms of illumination, जैसे Dr. Deepti ने बोला, it will actually help you for all of those things. So that's another winner I think that we have here. A lot of people are asking about mostly about the ingredients. So of course we touched base on the AHA, which was in Proceuticals, and then we also touched on vitamin C. अब हमारे पास we have something जो एक actually hero ingredient भी है skin care में, which is basically retinol. And जब हम retinol की बात करते हैं, so again overly sensitive topic, because retinol is something जो कुछ लोग उससे दूर भी भागते हैं, because of course once you don't try it आपको नहीं पता चलेगा वो उसकी efficacy क्या है उस product की. So retinol is another one of our products in this range. And of course, we all know retinol is great when it comes to wrinkles, when it comes to lifting the skin. It's like a powerhouse of a product. But you tell us, doctor, ki why retinol? Matlab, there is so many vitamins out there. How does this make
retinol is actually
the hero of
a vitamin A,
How
and
it kind of
protects the skin barrier, it repairs the skin barrier, also helps pumping up of the skin cells. So when you need bounce in your skin, like more elastin, so it's like a messenger. So it just bounces back your skin. It improves the plumpness of the skin cells. It is also exfoliating, so it exfoliates the dead cells. So it also acne because it is exfoliating. So it is also given as a part of acne treatment and also the scar treatment to build collagen. It is used for anti-aging, for fine lines, wrinkles, the superficial, fine lines that you see. So if you're with your retinol, those superficial fine lines take a long time to come on your skin rather than coming early. So these are multiple benefits of retinol, but the one thing is that because it cannot be tolerated by everyone equally, so it has to be, when you start a retinol, it's very important to do a little patch test or do a little trial before you go on with the whole full-fledged regime with retinol. I would recommend start with alternate nights and see how your skin behaves, how your skin reacts to it. It can be skin sensitive to sun, so just make sure that you're already not super sensitive to sun, or your job is not to just stand in sun all the time. So if kind of jobs, you have to be a little extra careful and consult your doctor before you go in for retinol. So, and otherwise, if you're having a good lifestyle, you have good skin hydration, skin is not super sensitive, start with alternate nights, and then you can build over a period of time to every night, like 4 nights in a week, and then give a break with a repairing cream at night, or some peptide at night, and then again go in for like 4 nights straight away, and 1 night can be exfoliating night. So you can mix and match and build upon your skincare regime what suits your skin. And if you're super confused, you can go to a dermatologist and discuss it. These are great ingredients everybody should be including in their skincare regime.
Yeah. I think you've touched on a very nice, like the app point key. You should not shy away from these ingredients, right? जैसे आपने बोला, you can use for 4 nights अगर आप retinol use कर रहे हैं, you can skip 1 night of retinol and then maybe use an AHA instead. So that is a great way to kind of use these products. So it's not कि आप एक ही चीज को continuous use कर रहे हैं, you can mix and match. But very important, I think you should know your skin, right? अगर आप if you don't know what your skin requires, then it's a little difficult to choose the right product. And of course, with that, we also have the last one in the range, which is called the peptide, capsule. So that is again one of the product which is basically firming के लिए, it's again like, we use this age old method कि जब mattress बहुत पुराना हो जाता है, so that plumpness, goes away. So it's basically how your skin works as well. जब आप age होते हैं, of course, that also goes away from your skin, that, plumpness, that, that bounce. So that product, of course, helps. But what actually helps in the ingredient is the peptides. So what can you say about peptides again, and how different are they actually? Yeah, how
Peptides,
similar or how
first of all,
different
are very,
are they
very safe
from
to
a
use.
retinol or maybe some
Everybody
other
can
ingredient?
use it without thinking twice because they are generally very reactive. They are simply like messengers to the skin, so they can penetrate the skin. So when they penetrate the skin, they are giving signals to the skin cells to produce more collagen, more elastin, function better. So our जो धीरे-धीरे time के साथ the functioning becomes very slow. It just gives messenger. It acts like a messenger to the skin. Oh, hello, come on, you need to start working better. So when you're getting old, or when your skin is aging, or when your skin is drying and it is not getting the proper signal of what it needs to do, so these act as messengers and it helps the skin function better. So if you have good, it helps in improve collagen, improve elastin, improve hydration. It helps with open pores. So it's got multiple benefits, and it's really helps in, as you said, bulk of the skin. So it's one most important ingredient. You can include it in a day, include it at night, include it with other things. So I would recommend, do not use peptides just alone, because usually if you combine them with certain vitamins or certain active ingredients, it's always better. Taking the message down and then you're taking the other ingredients down with them. So it's always good to combine a good active with that.
Okay, superb. I think that's again a great tip, that that sometimes we feel कि एक product हमने use कर लिया and that's it, we're done, sorted, but then a lot more goes in it. And I think going back to how we should use these products, because a lot many times again we can mix a few products, but it's very important to say कि आप एक time पे एक product ही आपको लगाना चाहिए और एक ही active लगाना चाहिए, because our skin, we should allow it to breathe as well.
Right.
So overusing products is also not the best thing to do. So I think that is also very, very key. And tell me one thing, also we hear about a lot of people, a lot of women who are pregnant or breastfeeding. What about using actives when it comes
the
to
hormones are all over the
cases?
place. You cannot be experimenting with stuff, first of all. And also the same ingredient can react in different way while you're pregnant, while you're breastfeeding, because the hormones are changing, the skin is changing because of hormones. You've been using certain products for a long time. Like, for example, you have been using vitamin C. The same vitamin C will not behave in the same way while you're pregnant or while you're breastfeeding. So you can specific or sensitive towards that do not experiment with new products while you're pregnant. Retinol, of course, is a no. While you're pregnant, we shouldn't be using. AHAs again are a no. You should not be using the actives or strong ingredients while you're pregnant or breastfeeding. So I would say refrain from it till the time your pregnancy is there, and you're just going for a milder version of the product. Just use niacinamides, peptides, moisturizing agents, and certain more natural agents rather than using strong active products.
Okay, super. Yeah, I think those were some great tips, and thank you so much for letting us know. And we also have a lot of questions pouring in. So we, of course, a lot of people are asking about, you are looking beautiful. So that was one of the comments too. And otherwise, we have a lot of people who are generally asking about skin types. So can these be used for oily skin, for sensitive skin? So if of course, normal skin type, as you said, it's very easy for these
See,
products to
for oily
develop in. But
skin,
what about oily
yes,
skin
of
and dry
course,
skin for
if
that
you're
matter?
breaking out too much, sometimes I would ask my patients to avoid vitamin C because some of them, like not everyone, but few of my patients, like I see few of the patients, they do react to vitamin C and end up with a flare up. So you're breaking out, try to avoid vitamin C for some time.
Okay.
If the skin is super sensitive, again, vitamin C can, the potent vitamin C like L-ascorbic acid can lead to dryness or little irritation on the skin. So if you feel that you can, cut down on your application of vitamin C. Or another way of applying would be you can mix it in your cream or a moisturizer so that it becomes less potent, and then you apply it. Probably the irritation part would be less. This is one thing about vitamin for acne prone skin.
Mm-hmm.
Also acne prone skin, I would suggest that retinol is a great choice for acne prone skin because it helps with acne, also helps with acne scars. So you can include for dry skin.
Yes.
Again, coming to peptides are a great option.
Yes.
Everybody should be using, whoever has dry skin or an aging skin, peptides are a must. You should be applying that. You can include hyaluronic acid with that. You can include other ingredients with the peptides. So you get a good hydration, and you can use it in the morning or at night. It doesn't matter. So peptides can be used at both the times. Vitamin C preferably used in the morning. Then what else do you have? You have AHAs. AHAs are great for oily skin. It will help you the inflammations, exfoliation. If you have acne and blackheads and whiteheads and clogged skin, AHA peels are excellent. They're going to exfoliate the skin. They're going to reduce the acne. It is also antibacterial, so it is going to kill the bacteria. So for skin, I think AHAs and retinols are great. For dry skin, peptides are great. So that's how you can divide it.
Okay. Oh, super. I think those are some, again, great information that has been shared. And also a lot of people are asking about hyperpigmentation, because hyperpigmentation is the first thing जो बहुत लोगों को problem होता है, so what is that one
See,
key
morning,
product
start
or
with your
an active
vitamin
that you
C.
would
It
say
helps
will
with
work the best
hyperpigmentation. You have to have a
for
sun
hyperpigmentation?
protection, no matter what. If you're using the actives or if anything, I think sunscreen remains the main important part. The best investment that you're going to make in skincare is sunscreen. If you do not use any, please use sunscreen, because I always like a bread and butter. You have to use sunscreen. You cannot skip a sunscreen, whether it's rainy, it's indoors. Today there's no sun, it's cloudy. Doctor, I don't like the sunscreen. You have to use a sunscreen. It doesn't matter. Find a sunscreen which suits your skin. If you can't find it, you go to a dermatologist. Look for a good sunscreen that suits your particular skin type, which you can continue for a long time. So sunscreen application remains very important for hyperpigmented skin. Also, there are sometimes triggers which are happening due to hormones. Get your hormones checked. Why this big happening? Sometimes it is vitamin deficiency, iron deficiencies. Get yourself checked why hyperpigmentation is happening. If you're on some oral contraceptive pills, they can also lead to hyperpigmentation. So a lot of medication, like discuss with doctor what all medications are you taking. Probably that is hyperpigmentation. So multiple causes of hyperpigmentation, but yes, vitamin C you can include. You can include AHAs, VHAs at night as a peeling solution. Alternate nights. You can include retinol, helps in pigmentation. So alternate nights of AHAs, and along with that, just add peptide each night. I think that should do the trick. If you're talking about this range, then yes, this is how you can go about pigmentation. But sunscreen, very important.
It's like it's actually like more than a cherry on the cake. It's basically the cake should be covered with that. Yes, it is the cake. Perfect. A lot of people are asking about AHA. So of course, I think you also shared कि हम इसको generally, if a person needs to start maybe once a week, but आपने बोला that even 2 times or 3 times in a week one can exfoliate. So that was one of the questions again that was asked. And how do we use it? Is somebody's asking that how should we kind of, supposingly they are doing their routine, like they're doing their cleansing, they're using a good serum, they're taking care of their eyes, and maybe then they are using a day night. So how
You can
should
take a few
the,
drops on your
how
palm,
should
pat
AHA
it,
kind
and
of
just
slip into
apply
that regime?
and massage it for like 5-10 minutes till the time it gets absorbed. And what kind of AHA you're using. If you're using this, I think you can just leave it on.
Oh,
And
okay.
if you're using more potent AHA, then sometimes you need to wash it as well.
Okay.
So it can come in pads, kind of pads soaked in AHAs. It can be a product like few drops of it, just pump and take few drops and apply it, massage. So yeah, different products can have different application depending on the potency of the product. That is very, very important.
Okay, all right. Yeah, I think that's again very, very important to understand the product when you actually use it. So, it's great to have that as well. I was just checking in for some more questions.
We're already at
I
half
have
an hour.
sensitive skin. Can I use
We can
vitamins?
take
Sorry?
one last.
Yes, we have actually quite pretty much on it. Yeah, actually, yeah, the questions are pretty much on the similar lines that, sensitive skin, hair, vitamin C use karna chahiye. You've answered that already. And guys, you can please go through the complete live. Dr. Dipti has, yes, we're gonna save it as well on both our channels, and of course, you will have all of it there. Redness, of course, is seen in some person is saying the redness. So again, these products, as Dr. Deepti said, कि ये थोड़े active होते हैं, so slowly and gradually build up in your regime. But I think the important takeaway is that yes, actives are important. They are very effective. And आपको of course अपनी regime में जो already you have a great regime of products set in your place, and these are always supporting that. So I think that is one takeaway that should be there from this live. And anything else you want to add on, doctor? Anything that you want
Send me as
all
much
the
heart as you
viewers
can.
who are sending you so many hearts and love to tell
Start your
them?
skincare regime. Why are you delaying it? You should be using a good skincare, since it is scientifically proven that these things improve the skin. And when people, oh, you've got great skin, it doesn't come naturally. You have to work towards it. If you work towards it, you will get it. But then you have to be consistent. So consistency and skincare is most important. I would say just start and be consistent.
Wow. I think that's a great takeaway, and thumbs up for everyone who is already in the regimen and using skincare as a regime, as a routine. Great. And for others, please start as Dr. Deepti has just told us, and do keep loving our products, and of course following these tips and tricks. And thank you so much, all of you, for logging in. Thank you so much, Dr. Deepti, for being with us, for talking about all these, ingredients, sharing your tips and tricks. It's not every day that, we get to talk to somebody, and especially about skincare and about these products. So thank you so much. And thank you everyone for tuning in and being with us here. Okay, bye-bye. See you guys. Bye-bye. Okay.